And Zara, we're expecting to see a knock-on effect to other services.
Yes, Aisling, so a huge impact in terms of the health service right across the country. The HSE telling us this lunchtime there's been around 14,000 procedures cancelled today. They say a significant number of surgeries cancelled, except for urgent cancer transplants and etc. They're saying dialysis continues, that has not been cancelled. So there's been an enormous impact today in terms of this disruption. I suppose just to note though that there is an emergency service available, and that these lab scientists have got an emergency procedure in place. But 2,100 of them out on the picket lines across the country today and this lunchtime protesting for better rights in terms of payment. Let's take a listen to what the root of this dispute is all about.
Well, the issue here is a long-standing dispute regarding the unequal pay between medical scientists and their scientific colleagues, clinical biochemists. Medical scientists and their clinical scientist colleagues, a report 20 years ago said they did the same work and should be paid at the same scale, but there is actually on average an 8% difference between them. And that's the issue that we're trying to address.
Well, this strike follows on from many rounds of unsuccessful discussions, the unions say, with the likes of the HSE, the Department of Health and the Department of Public Expenditure and Reform. In fact, meetings as recently as yesterday for up to 9 hours were unsuccessful. Let's just take a listen to some of those who were on the picket lines today.
I started here as a medical lab aide here in St. Vincents, and once I progressed in my career to be a medical scientist, I actually had to take a pay cut. So medical lab aides often report to scientists, and even though I progressed, did 5 years of training, that still meant a pay cut at the end of the day.
The last 2 years have been very stressful. You know, people have tried to work really hard, people have tried to keep up with the different demands and the extra demands. In the last 2 years we've had, I'd say, 10 people leave our laboratory.
For the last 2 years it has been brutal onslaught nearly in work, with demand ramping up and very, very difficult with a lot of staff positions remaining unfulfilled.
And that is one of the key issues that they point to today, is the fact that they have a number of vacancies in these labs that they're not able to fill, Aisling. They're saying that, for example, just here at Vincents, 10 people left over the last year and they've been unable to fill those vacancies. If this dispute continues, there are a number of further dates in the diary, including 2 further dates for next week on Tuesday and Wednesday. Also the 31st of May in the diary, and 2 dates for June, the 1st and 2nd, as I say, causing an enormous amount of disruption.
OK, Zara, thank you very much for that.